The scoliosis treatment that we provide here is called the ARC-3D treatment. ARC-3D stands for Active Reflex Correction in 3 dimensions, and the name implies the goal or the objective of the treatment. With the ARC-3D treatment, there are essentially, there are children who undergo the treatment and there are adults who undergo the treatment. When we look at a child with scoliosis, the typical management strategy is just observe the child until the curve gets bad enough, usually around 30 degrees, to where now we will either do bracing, or if that doesn't work, when it gets to 40 degrees and beyond, surgery is usually recommended. With the ARC-3D therapy for kids, the first thing that we start off with is something called a Scoliosis genetic test. What that genetic test does is it identifies children who are at high risk of their curvature progressing to a point that surgery would be necessary. The advantage with this genetic test is a child can be identified with a curvature as small as 10 degrees. And that test is within a very high accuracy to predict whether that 10-degree curvature is going to become a 40-degree curvature or beyond if nothing is done. The advantage on our end is if and when we identify these children who are at high risk, we can begin with a much more intensive, earlier stage intervention to keep the curvature from progressing and ultimately keep the child out of a rigid brace and definitely off the surgery table. Once that child has started undergoing treatment, a lot of the treatment is really home-based. This treatment really tries to serve to address some of the environmental factors that go hand in hand with the genetic predisposition, so that not only when we get a curvature correction, we can get more of a long-term sustained curvature correction. And at the present time, we have 5-year data that shows that the corrections that we get with the ARC-3D treatment definitely last, and in many cases actually still improve over the course of time. The one thing that we also like to stress is that scoliosis treatment, especially within the ARC-3D program, is a lot more than just the actual Cobb angle. People with scoliosis tend to have all kinds of problems with quality of life, whether that be breathing problems, digestive problems, problems with neurotransmitter imbalances, balance and coordination issues. And so we try to address all of those things. It's one thing to correct a spine, but if it doesn't have an impact on that patient's quality of life, we're really not doing a whole lot. Therefore, when we treat a child, or any patient for that matter, with scoliosis using the ARC-3D program, we like to use their breathing function as an outcome assessment, their digestive function, laboratory assessments of neurotransmitters, and postural assessments. In other words, is their rib hump getting smaller? Is their posture improving? Are they getting taller? Is their posture becoming more upright and more confident looking? And so we're looking for all of those things. Those same outcome assessments apply to adults who also come in with scoliosis. We're not necessarily looking to get as much of a correction per se as we might in a child. For instance, an adult who is having a lot of pain because of their scoliosis, their pain and their quality of life might be dramatically improved from a 10, a 20, a 30, or a 40% correction in their scoliosis, improvement in their rib hump, improvements in breathing function, all of those things. And so when we look at all of the parameters as a whole, or more of a whole body, total mind and body approach to scoliosis treatment under the ARC-3D program, people tend to see much faster results. And like I said, according to the data we already have on file, and it's already being published in peer-reviewed biomedical journals, that we have 5-year data to show that the treatment effect lasts. And that's by far and away the most important thing. A treatment that is trying to get results in a very short period of time doesn't really necessarily take into account what the patient is going to look like in 10 years, 20 years, 30 years. And so with the ARC-3D program, we're really trying to get to a situation where I'm not necessarily as concerned with what the patient's spine and posture are going to look like in a month from now. I'm more concerned what that patient's appearance, spine, quality of life, what those things are in 20 years from now or 30 years from now, because that's really the kind of the true definition of health. And with the ARC3D program, the advantage with the actual treatment modalities is we've kind of collected a broad number of therapies within this umbrella called ARC3D. For example, I'm honored enough to be part of the SOSORT Scientific Committee on Scoliosis Treatment. And it has members from all over the world: Italy, Spain, Japan, Germany, the United States, Canada, England. And we've collected a lot of therapies used in all of these countries and kind of cherry-picked those therapies that work the best. And we kind of use all of those for any given patient under the ARC3D umbrella. And that way, every patient coming here for scoliosis treatment is really going to kind of get some of the best techniques across the entire planet. Whether we use them in conjunction with scoliosis bracing or without, depending on if it's a child or an adult. And so we're really excited about the scoliosis program that we have here because it is so adaptable to each individual patient. And we look forward to even having longer term than 5-year follow-up, 8 years, 10 years, 20-year data to really see that we're really changing people's lives.